You know, when it comes to home health, you always want someone who's going to, whether it be for yourself, a loved one, whatever, to get the best possible care. Well, we have in the studio with us today from Deaconess Home Care Center, Suzanne Bridges and Nicole Landry. Thank you for being on the show with us this morning. We're talking about Deaconess and all the different benefits that have to work with your company. If you would, Suzanne, tell us a little background real quick about Deaconess.
Well, our company was founded in 1994 in a small town in Louisiana. And when our owners started the company, their mission was to help people age independently in their home. Mm-hmm. And it's all about helping people. And still to this day, that is what at Deaconess Home Health that we do try and strive for, is it's all about helping people and age independently in their homes.
And that makes it so much comfortable for them whenever they do that. Tell us, what is home health?
Home health actually provides skilled service for any patients that may need help recovering from a surgery, that have some type of exacerbation of some type of disease like congestive heart failure or COPD, diabetes, something like that. They can come in and just provide the help and teaching that patients need to get organized with their medicine, rehab like they need to. That's pretty much what they do.
Mm-hmm. Well, who can benefit from Deaconess Home Health, and how would I know if I'm eligible? I mean, right now, good Lord willing, I'm healthy. So, but how would someone know if they would be qualified?
When you go to your provider, and whether that be your primary care provider or a specialist, you can always ask them about the opportunities that they can provide with home health. Mm-hmm. And when you go to your doctor's office visit, that you can ask for a referral to come with Deaconess Home Health, or even follow in any surgery. Mm-hmm. You can talk to your provider, or if you feel like you have a family or friend or a loved one that could benefit from our services, you can always call our office and we can help get you in touch with who you need to be with.
Well, what type of services does Deaconess Home Health provide?
We do nursing, all therapies, that's physical therapy, speech therapy, occupational therapy. And we also, something that we're real proud of, we have a wound care nurse that is certified in ostomy care, which is huge for some of these patients that may have a new ostomy or something like that are having trouble with the fittings or chafing or anything like that. That is her specialty. Mm-hmm. And she's in all of our offices. She covers for all of us. And so that is something that we can do for these patients. And yeah.
Pretty much it.
Yeah.
Sounds like a real broad spectrum of the services that y'all provide. Is. And I'm sure a lot of people are going to wonder, who pays for this? Who pays for home health?
Medicare pays 100%.
Really?
Medicare is the payer. Humana and the Advantage plans, they pay too. But Medicare is the primary payer source. Now there are, we have to make sure they're in network, but private insurances, it just depends on what's going on with the patient. Mm-hmm. To see if they'll pay.
Now I'm sure this is going to be a big question for a lot of people. Is home health safe right now for during this COVID-19 pandemic?
Absolutely, absolutely. We are Joint Commission accredited, and that means that we have to meet the standards that every hospital, every clinic also meets. Mm-hmm. And we are screened daily, all of our staff is screened daily for COVID symptoms, and so we have to meet all of the same credentials that any hospital at this time meets, and also the clinics.
So you go through all this, make sure that your patients and your medical experts, they're protected during this time.
Absolutely.
Absolutely. And that is one thing, I feel like our company, Deaconess, feels strongly about, is making sure that including our staff and including the patients when we come out to see them, mm-hmm. because, right now it's hard to get into the hospitals, it's hard to get into the emergency rooms. So we are fully functioning and making sure we take every precaution and make sure everybody's safe.
Okay. How is home health different than personal care services? Come check on me, or my loved one helping with bathing or dressing or things around the house.
Well, I would say personal home health has a skilled need. There has to be something teachable. Like, let's say someone has a ton of medicines and you realize that your mother doesn't know how to take them or she's not taking them. You know, we can send a nurse in to help her get those medicines adjusted, make sure she's taking everything correctly. A personal care type service would come in strictly for bathing, grocery shopping, cleaning, stuff like that. This is more of a coming in just to make sure whatever the problem is, we're addressing it and taking care of it. You know, if a patient had surgery, then we're going to come in there and provide some therapy. We're going to do some wound care. The personal care places, they're not able to provide skilled care. Now, they are a good addition to what we're doing, but we come in with that skilled care.
So yours is more along the medical side of thing, as far as any kind of medical help or treatment that they need, as you said, with wound care, you know, changing dressings, things like that, any kind of therapy that they need, you know, post surgery or anything like that.
Absolutely, because we have physical therapists, occupational therapists, speech therapists, and registered nurses that are all certified and have education and function very independently in the home and can come out and teach the patients exactly what they're needing to have help with.
So your nurses basically, I mean, you have the same qualifications as nurses in a hospital or in a doctor's office.
Absolutely, absolutely. And I feel like our nurses are very skilled. They always are in the homes and see a wide variety of patients, and they are very well vast from surgical wounds to treating diabetes to helping patients that have a COPD exacerbation to teaching patients about their medications and why they need to take certain medications and making sure their medications are taken how they should be.
Yeah, that's always the thing with a lot of these patients, is because, I mean, they might forget. I mean, they may have dementia or something like that. They forget to take the medications, or they're not sure what to take. And you definitely don't want them to get the medications mixed up.
Right.
You know, taking too many of one thing or another.
Absolutely. And, you know, some of the other things that we do, patients that fall a lot, or they have a fall risk, or they're afraid to walk to the mailbox because they're afraid they might fall. You know, you don't always have to have nursing. You can do just therapy. A physical therapist can come work with them and do help them walk to the mailbox, or help them build that confidence where they can get there. Our occupational therapists can come in and work with people that have low vision, that maybe are having trouble seeing their medicines and such. We have a low vision program that they can work with.
All right. Well, we're going to mention that real quick here, that if you need some information from any of them, you can call the number on your screen. They're located in Van Cleve, Biloxi, and Gulfport. Deaconess Home Care.